There are a variety of ways in which we can actually elevate the eyebrow. So there are non-surgical options, and one of that non-surgical option is utilizing neurotoxins. By injecting neurotoxins in strategic places, what we're doing is that we're weakening the muscle that continues to drag the eyebrow down. And one of the key muscle is the orbicularis muscle. And so if we weaken that orbicularis muscle, then the eyebrow actually goes up. And it works quite well in a lot of patients as long as we do it correctly and not use too much neurotoxins to accomplish that. The other thing that we can actually do for certain patients is by injecting fillers right below the eyebrow. Now, this is not for everyone, but it is for people who doesn't really have prominence to what we call the supraorbital rim. And in those patients, what happens is that because there isn't much support there, it's easier for the eyebrow to droop down. So what we do is that we inject the filler right beneath the eyebrow, and what that does is that it provides a structural support to lift the eyebrow up and therefore achieve brow lift. From a surgical standpoint, the more common way that we address a true sort of brow ptosis is by doing a brow lift or the forehead lift. And what we're doing is that we're taking the entire forehead and temple and we're elevating that up. Traditionally, there's two ways of doing it. One is what we call an open brow lift, which means we make an incision across the entire scalp and lift everything up, or endoscopic, which is kind of the newer technique and the one that I favor, which is we make segmental small incisions, usually 5 incisions behind the hairline, and we utilize the camera to free everything up and then lift. In terms of the result, I guess it kind of depends on who's doing it and what they're familiar with. In my hands and in our practice, I really feel like endoscopic brow lift is by far more superior to an open brow lift, not just because of the incision, but also because of the recovery time, because it shortens it. And there just is a less sort of complication that can happen.